Management of shoulder arthritis in the young patient in shoulder surgery represents a challenge because shoulder implants, total shoulder implants, have a finite lifespan. So when we perform shoulder replacement surgery in a younger patient, we are going to worry about the longevity of the implant. Is this implant going to last this patient for the rest of their life? If it fails, what are we going to do then? So the shoulder replacement surgeons often think about that. There's been a lot of advancements in the field of shoulder replacement surgery in the recent years that are now allowing us to treat younger and younger patients who have severe arthritis but do require shoulder replacement surgery. It's a relative term, obviously. It's based on the activity level of the patient and based on their sort of physiological age, not so much their chronological age. So I have 70-year-old patients who are still hiking, biking, mountain biking, kayaking, but in terms of sort of chronological age, when we talk about young, I mean somebody 50 and younger. One of the more recent advancements is stemless total shoulder replacement. This is a more traditional total shoulder replacement that has a metal stem that goes into the arm bone and a socket that goes on the other side, and it goes into the shoulder and it replicates the shoulder. This is a more standard shoulder replacement. And more recently, we now have stemless implants. So the stemless implant functions the same. It has a coating on the backside, just like your traditional total shoulder, but it does not have a stem, so it still functions the same way. But because it's a smaller piece of metal and there's no stem that goes into the arm bone, you are sacrificing less bone, so it's more minimally invasive. So it's a good option for younger patients because you're removing less bone, and you also have more options for revision surgery down the road, because we know that the younger patient has more demand, and in their lifetime, if they have shoulder replacement at a younger age, they are going to wear that out at some point. So this is really revolutionizing the treatment of shoulder arthritis in the younger patient. And then there are some other options for younger patients with arthritis as well. For example, if their arthritis is not very severe, sometimes we can just arthroscopically go in and clean out the arthritis and give patients sufficient pain relief that way. Of course, we always try to get patients better without surgery first. We may try physical therapy, cortisone injections, and other treatment options before we consider surgical treatment.